Welcome to an overview of voice production with Resonate Voice and Speech Services. We are looking at the anatomy and physiology of voice. This is going to be a pretty basic overview. We have a great diagram here that I love to use. I purchased from Blue Tree Publishing. I love this view because you have a nice lateral view here, and you have a nice overhead superior view of the larynx looking down into the throat. And I really appreciate that this is a view that looks very indicative to what one would see with a laryngoscopy. So we have the right vocal cord would be this one here, and the left vocal cord would be this one here. So thinking about anatomy, I'm going to overview a couple of main landmarks here. So we have the larynx, which sits right in here on top of the trachea. So looking down in this view, we have our larynx made up of cartilages, muscles, membranes, ligaments, all of that. But as you can see, the two main cartilage right here, which is the thyroid cartilage, number 6, and then the cricoid cartilage, you can see that that sits right on top of these tracheal rings. Okay, so the trachea leads, of course, into the lungs, not pictured down in here. So when we look at the larynx, number 11, these are the vocal cords. So they sit horizontally on top of the windpipe. Again, looking down in this view, we have those true vocal cords, the two white strips here. You can see those tracheal rings down through the vocal cords when they're open, which is when we're breathing. Of course, the vocal cords open and close. It's a valve on top of our airway to protect the lungs. So when we have the closed vocal cords, they look like this in this picture. So back to this view, this side view here, we have the epiglottis, which is this cartilage, kind of leaf-shaped cartilage that is important for our swallow. Down here you can see the epiglottis kind of sticking out from above. So we have the epiglottis, and then going into the oral cavity, I like to point out this nice big base of tongue muscle right in here. So there's a lot to the base of tongue that we don't see when we open our mouth and stick out our tongue. We see this kind of blade of our tongue here. So this is important as far as voice goes. This can get really tight and tense, and when we work on base of tongue massages and stretches, this is the big muscle that we're referring to. So let's talk about voice production. Again, from a very basic standpoint, we have the larynx here on top of the airway that leads to the lungs. So the lungs is our source of our voice. It's the power behind our voice. So we bring in air on an inhale. And when we think of voice, we think of an active expiration process, meaning that we're activating muscles and we are exhaling, we're expiring that air. So we breathe in the air, which goes down into the lungs, and as we use our air to speak or to create voice, we are sending that air back up through the trachea. The vocal cords then close to create a voiced sound, and that airflow then flows right through the vocal cords, setting the vocal cords in motion to vibrate, causing a sound source. And then we filter that sound through the pharyngeal cavity of the throat, through the oral cavity of the mouth, and the nasal cavity, which is the different cavity of the nose. So we are using those cavities to resonate and to create resonance for our sound, to shape that sound into what we would call our voice. So this essentially, with the breath and the air moving up and out of our face in the cavities, we are creating resonance, we're creating voice, and we are promoting a sound. So of course, there's more specific details about voice production, using the diaphragm, those kinds of things, which we go over in our voice therapy. And this is, again, just a very basic view of vocal anatomy and voice production.